name is Omar Hashim. I'm refuting Brett Rogan's claim that medical marijuana legalization will be highly beneficial. My claim is that medical marijuana legalization would not be completely beneficial for the country. The supporting claims that I'm responding to are that alternative drugs to marijuana do not help as much as marijuana, and that marijuana can help with health issues. My response to the first supporting claim is that he only stated one alternative drug, and that's Marinol. However, Marinol is not the only alternative drug, as we all know, for marijuana. There's other counseling processes such as surgery, vagal, nerve stimulation, the ketogenic diet, complementary therapies, and counseling are all other options that treat or maybe even prevent seizures from happening from epilepsy. And that came from the article that I read called "The Treatments for Epilepsy" by Dr. Tim Kinney. Dr. Tim Kinney also stated that statistics show that these procedures have 8 in 10 patients that will have no problem controlling their seizures after going through these processes. And this would provide treatment excluding all the horrible side effects from marijuana that I'm going to bring up later, and proving that marijuana is by far not the best treatment for epilepsy. He also only talks about epilepsy. He forgets to support his claim that it treats cancer and AIDS. And so my second supporting claim that I'm responding to is that marijuana helps with health issues. And we all understand that marijuana helps with health issues, except he forgets to state that it also causes health issues. From the article, titled "What are Marijuana's Long-Term Effects on the Brain?" from the National Institute of Health, it states that THC affects how information is processed through the hippocampus part of the brain, which causes memory impairment. And it shows that experiments on rodents prove that the use of marijuana decreases the reactivity of the brain. Now we all understand that cannabinoids, sure, it does help with the brain, with treating brain seizures and everything, but THC also affects the brain heavily. The drugfreeworld.org website stated that cannabis causes short-term effects such as panic, distortion, anxiety, poor coordination, and risk of heart attack. It also states that long-term effects can occur such as the poor immune system, growth disorders, reduction of male sex hormones, and bipolar moods. All this only states that one thing, that marijuana is not completely beneficial to the human body. So yeah, thank you. That's it.
Okay, well, the proposition's identified pretty well. You have kind of a qualifying counterclaim that you're going to be talking about, and I think that that's pretty reasonable. You outlined the secondary issues adequately. On the first point, it got a little confusing because you were talking about alternatives. I think you need to state your declarative a little bit more firmly and argue that there are alternative treatments for seizures, which is what the advocate was talking about on that particular point, and then present your evidence there. You did do the post-citation thing that was a little bit problematic. You listed a whole bunch of stuff that are treatments for seizures. And then you told us, and that information comes from, that's a little bit backwards. The next piece of evidence was a lot more useful, and that said that 80% of patients who have seizures, these strategies are going to work for them. I thought that that was pretty effective. So the notion that marijuana is necessary, I think, is harder to demonstrate. And one of the things that I think you ought to be making at this point is is an argument that says, look, if the vast majority of these things are treatable by something else, then I think it's incumbent on the other side to show why marijuana is a more effective treatment. Kind of do a little contrasting argument there so that your position seems to be the one that's quantified, and when people are sitting back, well, I know the one he's arguing for is this successful. We didn't hear any evidence from the other side about how successful or how useful marijuana is, except that it can have these kinds of benefits. And I think that that would put you in a stronger position on that point. The cancer and AIDS argument came up, and I'm not exactly sure what your position on it was, and then it basically kind of disappeared again. So if you're not going to develop an argument there, you might just want to ignore it. If you're going to make an argument there, though, you ought to explain what it is. On the second point, basically you're suggesting that marijuana consumption does create a variety of health risks. I think that that's pretty good. You seem to be conceding the notion that the cannabinoids obviously have some beneficial effect on the brain. I don't know that that's obvious, but you were kind of granting it from the negative, from the advocate's point of view, and just saying, but it also has these contrary effects. And I thought you illustrated the contrary effects pretty well. One of the things that you might want to do in the contrasting argument is to say, look, if we've got treatments for these things that don't have these negative adverse effects, and they're successful, and marijuana might be successful, but we don't know how much it is successful, but we also know it has all of these negative connotations, then perhaps it is a real danger to make this available to people to use. You know, it's like at the end of every one of those pharmaceutical ads that people have seen where they start listing all, they spend the last 30 seconds of the ad telling about all the crappy stuff that can happen to you if you take it. That's basically, the same thing that's going on here, and there's a question about how certain are we about these sorts of things, and you had some pretty good evidence on those points. All right, thank you.